Hello everyone, my name is Daniela and today I'm going to be talking about HIV, or Human Immunodeficiency Virus. HIV is a retrovirus that occurs as two types, HIV-1 and HIV-2. HIV-1 is mostly in the United States and worldwide. HIV-2 is rare and is mostly just in Western Africa and Southern Asia. It is from the family Retroviridae and the lentivirus genus. A retrovirus is a type of virus that uses RNA as its genetic material. After infecting a cell, a retrovirus uses an enzyme called reverse transcriptase to convert its RNA into DNA. The retrovirus then integrates its viral DNA into the DNA of the host cell, which allows the retrovirus to replicate. The reservoir for HIV is the human body. It is a blood-borne virus. According to HIV.org, approximately 1.2 million people in the United States are living with HIV today. About 14% of them don't know it and actually need testing. HIV has a disproportionate impact on ethnic minorities and gay and bisexual men. In 2018, an estimated 36,400 new HIV infections occurred in the United States. HIV has unusual morphological characteristics, like a cylindrical or cone-shaped nucleoid in the mature virion, which is what you see in the middle of the picture. It is a single-stranded enveloped RNA retrovirus. The picture here shows in detail the different features of the HIV virus, like the lipid envelope, MHC proteins, and the reverse transcriptase. HIV is difficult to treat because the mutation rate is so high. When HIV is replicating, it can create about 10 billion new HIV virions a day. HIV enters the bloodstream and targets T helper cells, or CD4 cells, to replicate itself. T helper cells are a type of white blood cell that play an essential role in our immune system and to fight infections. HIV attaches and gains entry to the T helper cell and replicates. During this process, infected T helper cells die and the HIV virus starts to seek other T helper cells to infect. This causes the body to be left in a weak state and not be able to fight off infections and disease. When HIV enters the body, it establishes itself in the lymphoid tissue where T helper cells are targeted. The T helper cells count in the body decreases. So this means that there's a decline in CD4 cells. This can take several years before the body reaches a low number. So a healthy person has between 600 to 1200 cells per cubic milliliter of blood. When CD4 cells reach very low levels, a person is at risk for infection and disease. When CD4 cell count drops to 200 cells or less, HIV has turned into AIDS, which stands for Acquired Immune Deficiency Syndrome. HIV is a disease of the immune system. HIV destroys the CD4 lymphocytes of the immune system, leaving the body vulnerable to life-threatening infections and cancers. The most common diseases that can occur are pneumonia, so with your lungs, Kaposi sarcoma, which is a type of skin cancer, cytomegalovirus, which is a viral infection that affects the eyes, and candidiasis, that is a fungal infection that can cause infections in the throat or vagina. Other AIDS-related infections can include bacterial infections like recurrent bacterial pneumonia, tuberculosis, and Mycobacterium avium complex. Viral infections include hepatitis C and herpes simplex virus. People living with HIV and/or AIDS are at greater risk for certain cancers than people with a healthy immune system. In the acute phase, which is the first 12 weeks, you might get flu-like symptoms that can last a couple days. Then comes the chronic stage, which can run anywhere from 2 to 10 years. There's usually no symptoms, but the body does have a decline in the T helper cells, as much as 1 billion a day. The last stage, which is AIDS, people can experience fever, fatigue, weight loss, and diarrhea. HIV is transmitted by direct sexual contact, by blood or blood products or via breast milk. There is no evidence that HIV can be transmitted by casual contact or that the virus is spread by insect bites, as some people think. The predominant mode of transmission in the United States and Europe is via homosexual contact and the sharing of needles during drug use. In developing countries, the predominant mode of transmission is through heterosexual contact. Maternal transmission of HIV accounts for more than 90% of HIV infections in infants and children. In the United States, approximately 20% of untreated pregnant HIV-infected women transmit the virus to their infants, and an estimated 50 to 70% of mother-to-child transmission occurs late in pregnancy or during birth. Postnatal HIV infection may occur through breastfeeding. The virus must enter the body as either cell-free virions or infected cells. The mode of transmission determines the initial cells that the virus encounters, either through mucosal surfaces or direct inoculation into the blood. There are three kinds of tests for diagnosis. The first one is the antibody test, which looks for antibodies against HIV. The second is the antibody and antigen test, which looks for antibodies against HIV and the virus itself. The third is the RNA and DNA test, which looks for copies of the viral DNA, since HIV is a retrovirus. The recommended test is the antibody and antigen test because it is better at identifying early infection. If it is positive, it is recommended to do an antibody test to confirm. There is no cure for HIV or AIDS. However, treatment can help someone with HIV or AIDS live a longer and healthier life. There is antiretroviral therapy, or for short ART, which is a combination of medications that slow down HIV replication and help the immune system recover and fight other infections. You don't die from AIDS, but AIDS-related complications, since the body can be too weak to fight off disease and infection. In order to prevent HIV, abstinence is recommended or the use of condoms. Another suggestion is getting tested for STDs if you are sexually active. It is better to know early to get treatment than to know when it's already too late. There is no vaccine yet, but there is treatment, the antiretroviral therapy that slows down HIV replication. Did you know that 1 in 7 people living with HIV in the United States don't know that they have HIV? Did you know that in 2018 there were 15,820 deaths among adults and adolescents with diagnosed HIV in the United States? Did you know that in 2018 there were about 38 million people in the whole world with HIV and/or AIDS? 1.8 million of those people were children. Here are my references. Thank you for watching, and feel free to leave comments or questions.